All right. All right. We are really excited to announce our partnership with ABPM and APMA. And what better way to kick off this partnership with our very special guest, Dr. DeHeer. And we also have a marathon of Go Live that's going to happen. If you go to our account, you can check out that we have 6 Go Live sessions planned out. Each one talks about very different things, kind of catered to externships and residency interviews and things like that. So we're going to be talking about CV, how to make a better list to apply for residencies, do's and don'ts about interviews, and how to make a good impression. And to end our marathon of Go Live, we have a Q&A session as well. So if you guys have any questions, please make sure to write it down. If I didn't get to it, you can definitely attend our very last Go Live session and ask those questions. So without further ado, let me invite our very special guest, Dr. DeHeer. Hi, Dr. DeHeer.
Hi, how are you?
How are you? So I'm just going to give you guys a little bit of introduction about Dr. DeHeer. So if you guys ever wondered what you could possibly do as a podiatric medicine doctor, you should ask him because he has a long list of things that he's involved in. So Dr. DeHeer, tell us about the organizations that you're a part of.
Well, first and foremost, I'm a trustee for the APMA Board of Trustees. I'm a fellow of the American College of Foot and Ankle Surgeons and the American College of Foot and Ankle Pediatrics and the American Society of Podiatric Surgeons. So I've been intimately involved with those organizations over the years as well. Those are the main ones. I've also a member of the sports medicine organization as well.
Yeah, so as you guys can see that there's so many things that you can be part of, and there's so many ways you can be involved as a podiatric medicine physician. But and the process of it, what we wanted to talk about is how COVID-19 is affecting the people who are trying to become a podiatric medicine physician, especially the fourth years who are having trouble attending externships. So Dr. DeHeer wrote an article about it on Podiatry Today, and he talked about some of the solutions about it. So tell us a little bit more about your article, Dr. DeHeer.
Well, it really started from students contacting me as a residency director. I'm a residency director at Ascension St. Vincent's in Indianapolis, and they were being displaced from their externships even further out in the year. I'll give you an example. I have 5 externs at my program this month, and one of them just had an externship in November canceled, which I thought was just crazy. Yeah. So I started seeing all these emails coming in from students looking to see if they could rotate at our program. And I just realized that there was a huge problem that was occurring that hadn't been addressed or recognized. So I brought it up to my fellow trustees at APMA. We set up a call with COTH, the chair, Carrie Sweet. Dr. Carrie Sweet's the chair of the Council on Teaching Hospitals. And we discussed the problem. And then he and I had a conversation also one-on-one about it to try to come up with some solutions. And all through that process, we were really working with APMSA to try to get input from APMSA and the representatives at the various schools, as well as the liaisons to the various organizations like Abinov is a liaison to the Board of Trustees. So trying to sort of get some ideas from him too on the process. And I just thought I needed to bring it out to the profession as a whole as a problem, really to try to encourage other residency programs to try to expand their slots, to open up some more slots. I increased my slots already going into the year by 1. And then once everything was happening, I decided to add another slot. 5 is really the maximum we can take a month. So, and then talking with Dr. Sweet, trying to come up, with alternatives like 2-week rotations or 3-week rotations. It doesn't sound like moving CRIP back is going to be possible from January to February, but the submission date for both the students and the programs can be moved back to where it will not affect the notification date. So that would give the whole month of February as another potential month for a rotation.
Right.
I think the rotations are so critical for both parties, for the students to get to know the residency programs and the people involved with the programs, and vice versa. But it also helps prepare students as they go into a residency program to just get some experience and some hands-on before they start their residency program.
Yeah, just to help them feel better prepared for it.
Sure, absolutely.
You also mentioned that December is another month that students could do externships as well.
Yes, that was one of the proposals. You know, the whole thing about that being a board month and studying for boards and then preparing for CRIP interviews, that's a concern. But I mean, they're extraordinary circumstances that we're dealing with, so we have to sort of think outside the box a little bit, I think.
So what do you think that students can do, or how can they put their input to help with this?
I think communicating to their APMSA reps is great. All the APMA Board of Trustees, our emails are on the APMA website, and I'm really responsive. If students email me, you know, I take it serious and I try to respond and immediately. So you can respond to all the board members or email all the board members. Our emails are right on the website, and you know, we are sort of at the top as far as the things that happen within the profession. And we're always trying to take into account the students' needs when it comes to these type of problems that relate directly to the student.
That's really awesome. So what's your thought about virtual externships?
So I can tell you for the residency program for the second half of March and all of April and into May a little bit, we were doing virtual education sessions. So we have a Tuesday morning journal club, and that's fine to do education, like we do articles and go through articles together, or I would do lectures for them and then we would discuss it. So there is a role for it, but I think it's a limited role. I don't think it's the best way to learn. You need to, it's like much with the telemedicine visits.
Right.
Podiatry has some limited use for telemedicine, but our profession is so much hands-on that it has limitations with those types of things, I think.
Right. So do you feel like for example, like the class that's going to be graduating, that when people are choosing residents, would residency programs be aware of that?
Oh, for sure, they have to. I took over as residency director about 1.5 years ago, so I've gone through 2 CRIPs as a residency director. I've always worked with residents my whole career, but more as an attending surgeon. And this year I actually opened it up to interview some students who did not do externships. So I think there's going to be a lot more of that, where you're not necessarily pigeonholed into just being able to interview with programs you've externed at. I think there's going to be more open interview process to people who have not rotated through the program.
Do you recommend that students try to speak with the program to get to know them personally, regardless of like the skill set of part of it? Because I feel like it's another thing that students and residency programs look into. It's like how well like they get along with one another and getting to know each other.
Yeah, you've got to get to know the culture of the program, and I think it's important to. There's a lot of things that are important when you're doing an externship. Seeing, are the residents actually doing the procedure? What's the academic part of it like? So that's really being in the mix for a month, that you learn those things that you can't always learn in a couple-day visit. But you know, communicating with the residency director, like I have no problem with students emailing me and wanting to discuss the program. We have 5 externs a month, but I had a student email me and she's coming in for a week this week, so I opened it up another just so she could visit for a week. I think everybody understands that these are challenging times and we all have to be a little bit flexible, and I don't think it hurts to reach out to the residency directors, or the chief resident at a program may be a good sort of entry point, and then letting them contact the director if you don't feel comfortable contacting the director directly.
Okay, so be more proactive about it. I mean, that's basically what we can do at this time, right? Like,
it is. I know COTH and CPME are still working on some things. We still, as programs, fill out a survey every week about have we canceled, are we, any changes with the program. They're still monitoring the programs. Unfortunately, one of the problems is not all the programs are responding to the survey, so that limits some of the information. But they're trying, they're doing everything they can. And some programs are limited by the hospital, like the Department of Medical Education within the hospital. ACGME is recommending virtual externships as opposed to in live, but CPME hasn't. So I went to our director of medical education. It's a big hospital system that our residency is a part of. And he's like, if your governing organization isn't forbidding you to have externs, then go for it. And so that's been really nice because there's a lot of pressure on the ACGME side of it for like family medicine or internal medicine. Those are a lot more going to be virtual.
Yeah, that's really frustrating, I bet, like for a lot of the students.
Yeah.
You're really, really involved with all of this for sure.
I am. I wear a lot of hats in the profession. That way I don't get too bored.
So what other hats do you wear? I know I saw your Instagram pictures where you've been to so many mission trips. Tell us a little bit about that.
Yeah, international medical service has been a big part of my career. I've been on over 30 trips across the world, mostly in Haiti, but I've been to Iraq, Honduras, Trinidad, Costa Rica, Ukraine. I think the post you saw, I went to Iraq twice. I went to Iraq in 2005, in October of 2005, and then I went back in June of 2006. So I was right in the middle of the war.
Yeah.
And I just went by myself. The first time I went with a real small group, not as part of the military or anything. I was just there to teach. So it was quite an experience.
I saw you wrote you were detained in Iraq.
Yeah, the first time that I went to Iraq, we flew into Amman, Jordan. We stayed there for a couple of days. And from the time that they changed, we left the U.S., they changed the documents to get in the country. So we flew from Amman, Jordan, which is a really short flight. We were on a tiny little plane, and this is a funny part of it. I get motion sickness pretty easily. So we're flying this really small plane into Baghdad in the middle of the war, and the pilot gets over the intercom and says, we cannot do a traditional landing. We have to do a corkscrew landing, which is where they go down in a circle to avoid surface-to-air missiles. So I'm trying not to get sick all over myself, and I'm just thinking surface-to-air missiles, surface-to-air missiles. So we land in Baghdad, and we go in through immigration, and we didn't have the right paperwork. It was like 5 O's. Yeah. So they didn't know what to do with us, so they just put us in jail until they could figure out.
Oh my God. Wow. That's quite an experience. I'd be freaking out. I'm the same way. I get motion sickness so easily, but I'm thinking at all this stress, then I don't know how you held it together.
Well, so they sent us back way late that night, and then we had to do it over a couple of days again. So I had to go back through that corkscrew landing thing and fly back into Baghdad and go back through immigration. But we had the right paperwork. We went to the embassy to get the right visas.
Okay. Wow. That's insane. What other countries did you go to?
I've gone to Haiti a lot. I've been there probably 15 or 16 times. Ukraine, Trinidad, Costa Rica, and Honduras was the first place I went in 2002. That was the first trip I went on.
So how is podiatric medicine different than here versus internationally?
Well, my experience in most of the countries is you're going to be working with orthopedic surgeons or general surgeons who are doing diabetic limb salvage, and they just do not have the specialization training that we have. So they're very eager to learn it. And the thing that I have sort of evolved in is not just going and doing like 20 or 30 surgeries. Now I only go to places where I'm going to be working with the local physicians and teaching them and sharing my experience and knowledge with them so that they can pass it on. So now instead of helping 25 or 30 people, I'm helping 300, 400, 500 people. And particularly if I can work with the physicians who are training the local physicians, then it has even more of a mushrooming effect. So I try to only go and operate where I'm working side by side with local physicians, and it's more of a sharing experience as opposed to me just going and doing.
Yeah. No, I think that's really important. It's like you're not only helping like the community, but you're having a bigger effect by teaching someone. I can't remember the phrase where it's like you teach a man to fish and then you feed him for the rest of his life.
Yeah, I have 3 heroes in medicine, and one of them is Kay Wilkins. He's a a pediatric orthopedic surgeon from the University of Texas, San Antonio, and we worked on a clubfoot project together in Haiti, and we were lecturing at a conference together, and he said a quote that will live with me forever. He said, "We want to leave skills, not scars." And that just always resonated with me, and that's always been sort of I've tried to just incorporate that into any kind of international medical stuff that I do.
Yeah, that's really awesome. I mean, like, we definitely hope that we can do something like that too. You said our organization's name is Humanitarian of the Year or Humanitarian International?
Well, I work with a lot of different organizations.
Okay.
I started a nonprofit called Foot Aid to sort of match people who want to go on international medical service trips with places that want to have them. So we set up like 4 different programs: diabetic limb salvage, clubfoot, reconstructive surgery, and then a non-surgical. I wanted to have something available for everybody. And I had several students helping me with it. They've all gone into residency programs. So it's kind of just sitting there right now because I'm busy enough. I don't have time to do it myself. But I think the concept is there, and I think that the need is there. And it's just an opportunity that I hope to be able to get back to and really push forward, because it's hard to find these opportunities. You have to really be diligent and sort of dogged to try to find an opportunity to go into an international service trip.
Yeah, I definitely agree with that. Do you allow students as well, like students who are in school?
Yes, we had a couple of the students who were helping me went down with another doctor who was part of our organization to Haiti and worked in the diabetic limb salvage program. So, and I've had students come with me on other and residents on previous trips also. I might be going to Pakistan in the fall with Mark Meyerson as part of Steps to Walk. That's his organization. So I was supposed to go to India last year with him, but the trip got canceled at the last minute. So I'm hoping that, with everything sort of the way it is, that we were still able to go this year to Pakistan. He goes on a lot of trips every year, but he's actually bringing podiatry in. He's asked a few of us to help participate. So I'm hoping that we can bring more people into his organization's really very big.
Yeah, I think this is another thing that we can do is like make a list of all these organizations so we can get it to people, because I feel like I wasn't aware of all these organizations that are making international trips to help people out.
Right.
So I feel like as students, we also look for, especially during summertime, we want to do something and like get our in and to see what it's like outside.
And it changes you, like in a deeper way. It changes you, and I'll never forget my first trip to Honduras. It was one of my former residents asked me to go with him, and we were operating on a little girl. She had 6 toes, and in a lot of developing countries, the kids, when they go to school, have to wear uniforms. Well, she had never been to school because she couldn't wear the shoes that she was supposed to wear, and she was like 7 or 8. So the procedure was like literally a 5-minute surgery to remove the extra toe. And we saw her and her mother later in the week for a post-op check, and her mom was in tears because now her daughter can go to school, which she had never been able to go to before, for something that was so easy that it took me 5 or 10 minutes to do. That's the kind of stuff that just changes people's lives, that you're able to have a significant impact.
Yeah, for sure. I feel like that's the main reason that we got into medicine, is that to help people out. And I feel like helping people who are like underprivileged makes such a big impact on you, as well as like on the patients that you're working with as well.
Yeah. And then the local physicians, a lot of they just don't get the specialty training, and they're so eager to learn like how to do foot surgery specifically. And we have so much to offer. I think sometimes we sell ourselves short, and even though they may not understand podiatry in developing countries, they are thirsty for the knowledge and experience that we have.
Yeah, no, I can agree with that. I did a little bit of summer work in Bangladesh, and I feel like I was learning so much, and I also felt like that there are other like international doctors helping out as well. And I feel like they make such a big impact on countries like that, for sure.
Yeah.
Okay, let's see. 25 medical mission trips. That's 30, you said, right?
Over 30, probably.
Over 30. Wow, that's really crazy. So you're married and then you have kids. So how do you balance all these awesome work that you do, as well as like being a podiatrist?
It's challenging. It's tough. Most of my kids, we're empty nesters now, so they're either in college or grown. But when they were little, I still made time for them. I coached, like, I have three kind of kids that are just really close together. I coached all three boys baseball teams when several seasons. So,
Wow.
and I was always coaching their basketball teams, and that was stuff that was important to me. Being on the APMA board of trustees is a lot of work, and
Mhm.
there's no way I could have done it back then because I was just, you have to balance your time, and there are different parts of your career that will give you different opportunities based on what your other responsibilities are. And I think that trying to find that happy work-life balance is important because you'll get burned out really quickly
Yeah,
if you don't.
for sure. On top of that, you're also the team podiatrist for Indiana Pacers, right?
Yes,
So tell us a
I've been
bit about that.
I've been the Pacers podiatrist for about 28 years or so. And I got started in it. The guy who was my mentor kind of did it unofficially. My dad was a real famous basketball player, and he got drafted by the Pacers, so they knew my last name. So when the opportunity came, they asked me if I would be the podiatrist, and I've worked with them ever since. So I've had a great experience with them. They kind of use me as they need me,
Mhm.
and what I do every year varies. Right this year, I've been treating the coach the most, actually.
Yeah.
So that's it's always fun. Sometimes things are urgent with players, and sometimes professional athletes in particular, can be a little bit difficult, and they're not always super cooperative. Like, you may make a player a pair of orthotics, and he gives his shoes away,
Mhm.
and he doesn't have his orthotics anymore. So then you've got to hurry up and get them a new pair of orthotics. That happens more than you would believe. So stuff like that, and especially when it comes to like playoff time, think everything is so urgent, and there is a lot of pressure to get people back on the court for basketball specifically,
Yeah.
because professional athletes are like they're like companies now. I mean, they're like these big corporations, and there's so much pressure on them being able to perform that gets translated to you as a care provider.
Right, for sure. Did you think that sports medicine is going to be your specialty?
I actually do a lot of everything. I get
Okay.
bored if I do too. If you ask me what my main specialty is, it's probably reconstructive foot and ankle surgery. I do a lot of surgery. I do a lot of peds. I like pediatric surgery. That's probably the thing
Yeah.
I do the most. But um, sports medicine, I've always been a huge basketball fan. So basketball was something I was how to deal with basketball players. So now, because I am the Pacers team podiatrist, I do get a lot of like high school basketball players and junior high basketball players and even college basketball players coming in to see me in my private office too. But I think as you're going through a residency program, seeing what resonates with you and what speaks to you, um, and then kind of trying to dive into that subspecialty within the profession and learn more about it. There's so many great organizations within our profession that if you want to get more involved or learn more about a specialty within the profession, there's a way for you to do that. And like for example, for me, I'm really involved with the ACFAP, the pediatric group, and I lecture at their meeting every year. And I was the editor of a clinics in pediatric medicine and surgery that was all on pediatrics. So there's always opportunities like that if you pursue those things.
So are there residencies that cater to specific specialties like sports medicine versus like pediatric, and people could choose a residency based on that?
I think probably what you'll find more is there'll be certain attendings who are really well known for those subspecial or those specialties, whereas the residency program should be really well rounded.
Mhm.
You don't want it to be too narrowed, but hopefully you'll get to work with somebody that specializes in something that you're interested in. Like we at our residency program, we have a couple of podiatrists that do a lot of trauma. I do mostly reconstructive surgery, but a couple of them do a lot of trauma. So they're hopefully you get that broad experience because that's what you should be getting when you're a resident. I just filmed something for APMA for the graduating residents that are coming out. That's going to go out on social media over the next week or two. And my one advice was to be a lifelong learner, continue to learn even after you get out of your program, and that's important. And so those organizations provide those avenues for you to get that more specialized training too.
So just watch out for that. Do you feel like that we as students kind of already know what we like, or we don't really realize it till we get to residency.
I mean, you may think that you know, and you may have a passion about something, and that's great, but really getting out and getting your hands into the mix of things is important, because you may think that you want to do total ankles, but then when you see all the headaches that go with doing that kind of surgery, you may I don't want to deal with that. Or you may have a passion for diabetic limb salvage or pediatrics or whatever. A lot of that I think you find when you're just in the trenches doing the surgery, seeing the patient, seeing the postoperative care, the preoperative evaluation of things. Hopefully you just go in open-minded and try to absorb as much knowledge as you can. And when you see something, it'll resonate with you and speak to you, and then pursue it.
So don't get too hung up on a thing that you want to do. It might change.
When you're in your residency program, learn as much as you can. Learn from every doctor that you can, that you work with, every clinic that you're in. Just try to absorb as much knowledge as you can. That's so important. And then you can kind of start to dial it into what you think is the way you want to practice.
Yeah, for sure. What is it like over there with COVID-19 right now?
So we're starting to open things back up. Our elective surgeries opened up about 3 weeks ago. About a week ago, I did 7 surgeries on a Friday. So I had 2 ankle fusions, adult flat foot surgery, a pediatric flat foot surgery, an MIS bunion, a gastroc recession, and this weird sort of sinus tract surgery. And then I think I have 3 or 4 surgeries this coming week. So things are opening back up. They still require patients to be COVID tested before surgery. And so this Monday morning's my normal block time. I don't have any surgeries tomorrow morning because we couldn't get the patients in to get COVID tested in time. So we had to go out a couple of weeks. So we're kind of filling our way through that process. And not all facilities are on the same sort of schedule, I would say, unfortunately. Some facilities are allowing the externs to come in and observe, some aren't. So we're trying to work around those hurdles with education. There's actually one hospital that isn't allowing the residents to scrub. So I just hope that everybody kind of gets on the same page soon from an educational standpoint.
Yeah. Well, there's a lot going on, and thank you so much for helping out with all of this a lot. I feel like it's really important that students feel less anxious about this whole process, and I feel like you are contributing a lot to lessening that anxiety, and we really, really thank you for that.
You're welcome. If anybody has any concerns or questions, it's just PADeHeer@apma.org is my email. I'm happy to help in any way I can, and just know that we're here for you, and it's a difficult time, but everybody just keep working through it, and we'll get back on the other side.
For sure. Thank you so much for joining us.
Oh, you're welcome. Thanks for having me.
Have a good day. Bye-bye.
All right, you too. Bye.